The name of the building is the Joan and Paul Rubschlager Building, and they are gracious donors who made a sizable gift to Rush, and we are recognizing them by naming the building after them.
You know, makes us feel good that we can do this.
Rush is just so important to us in so many ways.
Oh yeah, over 50 years we've been going.
And they had a business on the west side of Chicago, Rubschlager Breads, and they used to bring their employees here if there were any injuries or illnesses on the job, and they too also get their care here, and so we're very excited and very pleased for their gracious donation. The biggest part of my role is making sure that the design and functionality of this building works foremost for our patients and staff, making sure that that experience is top-notch. I've been a nurse about 30 years, and I've been in leadership roles for the past 20 years, and prior to that, practiced as a clinician at both the bedside and an ambulatory practice in cancer and infectious diseases and HIV care.
My role in the development of the Joan and Paul Rubschlager building is heading up the design and construction end. So I get to work with a lot of great people here at Rush. And the architecture and design team and the contractors have some really good folks in place.
Originally, the building design was supposed to encompass all of our ambulatory practices. We realized that we really want to concentrate our efforts on our cancer program and growing that program. And so it really evolved into a destination center for cancer and then also for our neurosciences programs. So those are the two main residents that are planned for the new building.
All right, good morning, everybody. Operations for this coming week.
So beginning of 2020, the project was doing well. We already were at steel and fireproofing was going on. We had some of the curtain walls showing up, and then COVID hits.
All of a sudden, we're faced with, what do we do? And a decision was made to go ahead and actually slow down on the construction of the building. It also did give us an opportunity, though, to reassess the volumes for our program. So what we did is we took a look at the volume projections for cancer and neurosciences. Again, patients would like to receive some of our services closer to their homes. So not everything needs to be done down here on this campus. So it gives the organization more of an opportunity to do something different with the 8th floor of the building than we had originally anticipated.
So now we're about at least 300 workers a day on the site. So we're back up to speed. Right now we're shooting for substantial completion, which means most of the construction is done by September of '22.
We were supposed to be putting the bridge up in June. We ran into a little snafu and kind of delayed its installation by a few weeks.
The bridge trusses are manufactured in Minnesota in 6 pieces, 4 50-foot pieces and 2 74-foot pieces.
It was a huge milestone. It's connecting kind of 2 parts of the campus. This is our entree onto the east side of Ashland.
Well, it's just a great pleasure to be able to be here and watch these huge pieces go into place. It's amazing. We've watched Rush since it was find a place to park on the street and walk over to it, and it's been a long time, and we've really watched it grow and enjoyed every bit of it.
To see it connected back into the tower is certainly momentous, and it's nice to see those green trusses up, and it's going to be an exciting summer to watch the finishing touches go on that bridge.
So the plan right now is that our first patient will be in January of '23. What we're working on now on the activation plan is to really decide whether we're going to open everything all at once, one day, big bang approach, or if we're going to phase it open over multiple weeks. I'm in favor of let's just do it. Let's get it done one day.